Is there anyone out there who still isn't clear about what doing drugs does? Okay, last time. This is your brain. This is drugs. This is your brain on drugs. Any questions?
Look away, Dixieland, 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 Dixieland. Praise God, rally, for this is the time and place.
All right, y'all, thank you for tuning in to Dixieland, the Proletariat. We're going to talk about Southern working class history and current events through a leftist perspective. Make sure to like us on social media at Dixieland the Proletariat or Dixie Prol. If you want to give your wages to a bunch of rednecks, then subscribe to our Patreon page at patreon.com/DixieProl. Got a lot of cool stuff to give you, including CDs, stickers, and the breakfast part of the cookbook is done and will be up July 1st. This podcast is brought to you by Newport 100s in a box, Camel Silver's Black Coffee, Vaping, Skid Row, and Crocodile. Shout out to our new Patreon subscribers, Doug, Carolyn, and Kathleen. Our monthly Patreon surplus goes to groups that are run by and help marginalized people directly. As always, I'm Nelson with Comrade Kate, former pig farmer Tyler, and our guest this evening is Morgan from Goodworks, North Alabama Harm Reduction. How is everyone?
Fan-fucking-tastic.
Doing all right.
Weirdly obsessed with that crazy gun couple in St. Louis. Fell down some hard rabbit holes today.
Yes. I am loving the memes. My favorite one so far is the Miami Vice one where they took him and they put him in GTA Miami Vice.
I've seen the photos. She has horrible trigger discipline.
Horrible.
She also has mustard all over her shirt.
Yeah,
Are
those
you
guns
sure
are
it's
straight
mustard?
out of the fucking 80s.
I want that AR though, because that AR looks like an 86 pre-band that has like fully auto capabilities, and I really want that one. And I don't know why that rich asshole has it, because
Nelson,
rich asshole.
hide your boner.
Look, I'm trying. I got gym shorts on, so it's gonna be really hard.
More information than
Bad joke,
anyone
bad
asked
joke.
for.
And now you know, and knowing is half the battle. G.I. Joe.
I quit.
Don't
I
push
quit
that
too.
imperialist propaganda.
Have you
Fuck
ever
the
watched the G.I. Joe voiceovers?
No.
Those are the best. Pork chop sandwiches. All right, fuck y'all. All right, y'all. So let's just dive right in. Morgan, can you tell us about your organization just to start off? Introduce yourself. Tell us what you just about the organization, what y'all do, just right off the bat.
Sure. Yeah. Morgan from Huntsville, Alabama. Goodworks is a totally self-funded project I started November of 2019. We basically do all we can to help anybody who's not being helped already. So people who are actively using drugs and need access to Narcan or clean supplies for using. If anybody wants to be hooked up with recovery programs, homeless shelters, whatever, we're kind of a resource hub. We were gonna go the fully above board route, but then COVID happened and all of our funding kind of dried up. So we just have to do what we can do for now.
Dig it. So can you go more in depth of like what harm reduction is? Because this is a term that I actually first heard about last year, and I'm really new to this. So like, what is harm reduction? Can you just give a brief rundown? Just give a rundown to people who don't necessarily know what harm reduction means.
Sure. Harm reduction is sort of a movement that started at the street level with communities of people who are in active use. So people who are using opiates and need access to clean syringes know where to go to find friendly pharmacists who can sell that to you if you're in a state where you can't access them, or your friend who always seems to have 2 extra vials of Narcan, whatever. So people started getting organized like they do. And the movement sort of started from there. There's kind of two different trains of thought within the movement itself. There's like the more prevention and recovery oriented organizations. And then there's folks like us who are just trying to meet people where they are and respect everyone's human right to do whatever they want to do with themselves. And we try to help them stay healthy and safe and happy while they go through the process. I don't personally care if anybody ever gets clean, sober, whatever. That's none of my business. That's a personal journey. And if you never make that decision, that's completely fine with me. Just please take good care of yourself and the people around you. That's really all we're trying to facilitate.
I'm glad you brought up the point of it's so many people push the you have to get sober shit, and it's not an option for everybody. I don't believe. And I believe
not. It's really not, and I don't think that it's necessary for everybody either. I think that there are a lot of programs out there that do more harm than good, and I think that it's been sort of a one-size-fits-all approach for a long time. And obviously that's not going to help. The country has sort of agreed, the government rather has sort of agreed to view substance use disorders as a medical problem, but we still treat it punitively. That's problematic in a lot of ways. The last time we criminalized a health situation, it was HIV, and we see how that's going. Alabama is still sort of at the epicenter of that pandemic. So pushing sobriety isn't effective at this point. Making sure that people are alive to find recovery if need be, that's kind of where I'm at. But again, if you never find that place, that's also fine. You don't need my judgment. From personal experience, I was my harshest critic the whole time I was using. So other people just chiming in and sharing that feeling didn't help me at all. That just added to all the self-loathing and the shame and the guilt and the bullshit. I wish that I had known about harm reduction when I was still in chaotic use, Yeah,
I'm a firm believer that if you're going to get sober, you've got to find your bottom. But I think it's so important that on your way to finding your bottom, you don't harm other people, say with dirty needles and stuff like that. So that's why I think harm reduction is such important. Because a lot of people don't talk about the Hep C and shit like that. That is a big problem.
That's an enormous problem. But the other problem right now, the biggest problem I think, is safe supply. Some people don't get a chance to find rock bottom anymore because they're getting drugs that they didn't think they were getting. Rock bottom for a lot of people looks like fucking dead. And death that's totally avoidable because naloxone. Or death, or it looks like, your 16-year-old prom night kid doing Molly for the first time, except it's dosed with fentanyl too. And next thing you know, you've got a room full of dead teenagers. Where was their opportunity to find rock bottom and make a decision to seek recovery? Did they even need recovery? They're just kids being stupid kids.
Yeah. I was lucky that my tail end of my using was right at the beginning of the whole fentanyl thing.
Mm-hmm.
So, I consider myself lucky because that shit it's crazy now.
Dude, it's ridiculous. There's a lot of issues with safe supply, though. Fentanyl is primarily manufactured in Mexico and China. So we can't really get a whole lot of it right now. So, criminals being an industrious lot, they've they've started creating new analogs. And there's a couple of like listservs that I follow that do some tracking. We've got, I think in the last 2 months, I've gotten 7 notifications of like novel analogs. These are being discovered by ATF, DEA, and processed through like government labs. So like full molecular structure and all of that's being sent out and passed out, but you don't hear about it. You know, like people on ground level aren't hearing about these new dangerous things. I don't know why. But then they're also going back to some of the older school stuff. Crocodile is making its way around. I've heard people like reports out of Atlanta, but these are unsubstantiated. Those aren't as scientific, but there's some reports coming out of Atlanta, crocodile coming back out. That shit's scary and disgusting. Please don't do it if you can help it. Test your drugs. Please test your drugs. That's, you know, that those test strips are illegal here too. To my understanding, test strips can catch you a paraphernalia charge in Alabama.
Wait, no shit.
That was my next question. Yeah, that was my next question, being in Alabama.
Dang.
So being in Alabama, one of the most conservative states, like what are some of the hurdles that you encounter when you are trying to help people?
Well, we would love to be able to distribute naloxone, but we cannot. That is illegal unless you have on staff a pharmacist, like a farm doctor, like you doctorate level education, the whole thing, you know, PharmD as they call them. And then the only other people who can hand it out are public health RNs. That's a master's level credential. So I'd have to find someone who would be willing to volunteer that time to me, because I'm a little tiny organization and can't pay myself, never mind, you know, a physician. Or somebody who makes like, you know, $90,000 a year as a nurse. I can't do that. So that's been hard to come by, especially since purchasing Narcan for my organization requires similar credentialing and shit tons of money, which I still don't have. Like in the 20 minutes that we've been talking, it hasn't happened. So we can't do it, which is endlessly frustrating. I have phone numbers for where people can go to request it. I have information about getting it from your pharmacy. But you know, our hands are tied there until they change the law. Also, getting clean syringes is complicated without a prescription. Also, packing up kits for people who use injection drugs, or use drugs by injection. I'm running a risk of catching a paraphernalia charge, whether or not there's like residue or any evidence of possession of a substance, just because certain things are packed next to each other. So a syringe, let's say you're a diabetic and you've got a bag of syringes, that's probably going to be fine. But if you have a bag of syringes and a bunch of cottons and the thing that you cook up in and this and this and this, regardless of the presence of any substance, you're likely to get a paraphernalia charge.
The fuck?
Yeah, I know, right? The fuck. So there's a lot of education about that we do, because I think that keeping people out of jails, especially during COVID, is a huge cornerstone of harm reduction. Like jails and police are not helpful, right? Do we agree here? Like,
Fuck the police.
Absolutely.
Yeah,
You're
no
definitely in the
one-
right space for that.
Yeah, no, fuck 12.
No
And that's
one
a
should
re-
be in jail for like a drug habit. I think that's something we can all agree on.
yeah, for sure.
I love how it was resounding fuck the police. That was beautiful.
That was beautiful.
Yeah.
Thanks, guys. You know, I have to also, you know, part of what I do is like naloxone administration training. There's people who are afraid to call 911 in the event of an overdose. And that has led to a lot of death. That's led to a lot of people dying unnecessarily, fear of the police, right? So there's certain things that we just don't say if we have to call 911. You never say overdose. You never say drugs or name of a drug or whatever. My friend fell down and they don't seem to be breathing, and leave it at that. There are ways to ensure your safety when you have to call 911. The police still might come, and there's some other things that you can do to sort of make sure that you're safe. I would recommend anybody looks into their Good Samaritan laws. Every state is different. That varies state by state. Alabama's got pretty good Samaritan law. You're not likely to get a possession charge if you're not physically in possession of a drug if you call 911 about an overdose. However, if there are felonious amounts of any substance in the house, I'd recommend getting fucking rid of it.
So the whole topic real quick of, you said people are afraid to call the police. So like police reform and like abolishing the police and things like that is huge right now. Like that's like the main thing everyone's talking about. So in your ideal society, right, according to Morgan, how would you like that whole aspect of what you just talked about to be handled if someone is overdosing, and how could the public and government in that aspect, what would you like to see?
In a perfect world, or in an actually happen?
What is the best case scenario?
Best case scenario would be that we didn't have that problem. Best case scenario would be that there is absolutely safe supply, meaning that we have access to substances that we know are irrefutably not dangerous when used in certain amounts. Now, if you go outside of these parameters, that's on you. But I'm about personal choice, right? So I'm not gonna. There's not gonna be like punitive outcomes for somebody pushing a substance or selling a substance that somebody then goes and misuses. There's also not going to be punitive outcomes for somebody trying to rescue somebody who did that. But the substances themselves would be safe if used within certain amounts.
So what does training for safe administration of Narcan look like? Like, who has access to that? Like, I'm going to assume, that you can't exactly use Narcan directly in a training. I'm just making assumptions here, but like, what does the process of like seeking out where to learn how to do that and making sure that you're getting good and accurate information?
So you can find that. I think Birmingham has a few different programs that do training a couple of times a year. I'd have to look up the names of the organizations, but one really good resource for national level information is harmreductioncoalition.org. They have excellent like videos and infographics and just all the stuff that you need. They can kind of get you hooked up with your local or state level organizations. There's links to local legislation. All the laws are kind of spelled out there. And then, if you've got a distro, like a distribution network in your area, they'll give you the information to hook up with those folks. They're really, really pro drug user, honestly. And there's states, even in the South, that have drug user unions. Those are for people who actively use and don't have any intention of quitting. Kind of like the sex workers outreach project, but like for people who use drugs.
Can you, that's new to me. So can you, probably to a lot of people, can you elaborate more on that? Like the drug users union, like how does that work? Honestly,
I can't. I've been I've had to really narrow my focus. So there's a lot of programs that I know about, and I know what they do. I know where they are, but in trying to be successful on the one project, I just can't really focus on all of that. And to further answer Kate's question, what it looks like training is go to a room, talk about, well, first and foremost, talk about stigma, talk about what it means to you to be interacting with somebody who uses drugs, or if you use drugs, what are your feelings about use and how do you feel you're viewed by the world? There's a lot of destigmatization talk. And then you kind of pass Narcan around, the most effective version being the vial and syringe, because it's fast, it's accurate, it gets in there whether somebody's breathing or not. Then you train how to do it. I would recommend getting CPR certified first, or shortly after if you can, because you can really mess somebody up with CPR. But what you can't do is fuck somebody up with Narcan. There are no contraindications for Narcan, regardless of what somebody else has been using. Like you're not gonna, if somebody's just passed out drunk and you think they're OD'd, if you give them Narcan, it's not gonna hurt them. There's no known allergy to Narcan. There's like no way you're gonna hurt somebody worse. They're gonna be mad at you because it puts you immediately into detox. But aside from that, or withdrawal rather, but aside from that, you're not hurting them at all.
So the answer to this question is fairly obvious. I just want to hear it, articulated by somebody like with a more knowledgeable background. If Narcan is so safe, if this is clearly something that is that low risk, but is so helpful in the prevention of unnecessary loss of life, why the fuck is it so hard to get your hands on it?
Bitch better have my money. It's
ding,
about
ding,
money.
ding, ding, ding.
Yeah, it's all about money. So I want somebody to Google how much money the state of Alabama makes on recovery. I want somebody to Google how much they make on pain clinics. There's a million and one reasons why.
Nelson, which one are you Googling? I'll look up a different one.
I was going to do recovery.
Okay.
You want to do the other one?
Yes.
So straight up, besides the pharmaceutical industry, prisons make money too. So there's all the reasons in the world to keep us strung out and keep us coming after this shit. There's also, in my personal opinion, a lot of benefit for the powers that be keeping us high and not paying any attention, keeping us isolated and depressed. Kind of means that we're not doing a whole lot about busting down their stupid fucking statues or overthrowing the government or abolishing the police. There's a lot there. I could go on. I'm probably already on too many lists though, so I'll stop.
So I looked up pain clinics and was immediately sidetracked by something really important on here, where you get employee reviews from pain clinics is one of the first thing that comes up. And it's the average review across the board is 2.5 stars. And it's basically that, that doctors and admin treat everyone like shit. They're not, lower staff aren't actually available to do any of their jobs accurately and treat people well. Oh my God. This is freaking absolutely freaking manners.
I also am curious about how much money our MAT clinics are bringing in, medication assisted treatment. Mm-hmm. So your methadone, your I can't remember the names. Anyway, methadone clinics, Vivitrol injections, all of that. You have to goose step for those fuckers too, and they'll get you in the pocketbook. It's basically like being on Color Code, but without the prison part.
Mm-hmm.
Yeah, I remember going with my friend to go get she would get Suboxone, and like the fucking doctor's office for the Suboxone, you'd have lines out the door. Like that shit's, it's insane how much money they make off that, and then people will turn around and make more money off of it. It's such a wild business.
It's ridiculous. And it's also really counterproductive for somebody who's trying to pull up and out of active use and the lifestyle it sort of keeps you in. It's just another version of the company store, you know, like you spend all day trying to work up money for dope, or you want to spend all day trying to work up money for Suboxone. What are you doing? Like, you don't have time to work, really, because you're standing in line all day.
How much does a single dose cost?
That is an excellent question. I want to say it's around 40.
Okay.
I would buy Suboxone off the street.
I just looked it up. It costs a nickel to manufacture a single dose.
Well, that's no surprise.
A nickel. Isn't commerce a bitch? Fuck capitalism.
Did we literally all just pause to drink?
Mine was water.
I'm still trying to look up my stuff. I can't find it anywhere.
I'm on a 2-episode
That
streak.
is more telling than not telling us, you know? Like, the fact that you can't find how much it is says a lot.
Alabama has, as of 2015, had 1.2 opiate prescriptions per capita. Holy shit.
Well, look at the past 4 years, how many doctors in Montgomery, Alabama were
Oh my God. Yeah. They just busted someone in Montgomery not too long ago.
Yeah. My friend, 3 of her doctors in 3 years got busted for pill mills. Like all of her sub doctors, her Adderall doctor, like, it's like, man.
I have stuff to say about that.
Oh shit.
What, Nelson? Sorry.
No, it's just like you just like, I have stuff to say about that. I was like, oh shit, here it comes.
No. So it's like the same reason we don't want to bust low-level dealers. We don't necessarily want to go busting all the doctors, right? Like, it's not helpful for one thing, but you're also not going after the guy. You're not getting the person who's actually pushing the drugs. This is likely just somebody who's writing a prescription to a patient that's in need, right? So you're just busting a low-level dealer. Like, this is just your fucking 12-year-old scrub-ass piece of shit who's like selling a couple of dime bags here and there, right? It's the equivalent of doing that. But you've got somebody who's like, you know, manufacturing fucking fentanyl and pushing that on people via the pharmaceutical industry. Like, do you want to go after the 12-year-old kid on the corner, or you want to go after the cartel?
So
same basic principle.
So question though, in regards to like distribution, particularly of things like fentanyl, because it's so like I'm based out of Memphis, and here everyone knows when a bad batch has come in because it's Friday night rolls around and everyone goes to a party, and Saturday night rolls around and everyone's at a wake, you know? Or so it's like, you know, it's everything, it's that immediate multiple ODs. So it's like really easy on like a more vigilante level to trace back who sold it, who brought it in, where it came from. We have our own ways of dealing with those people that I'm not going to get into. But do you all have a system in place for disseminating that kind of information so that people are aware and able to keep themselves safe in the purchasing process?
To various levels, yes, pretty much across the board. There are states in which it's easier to do this kind of tracking. I have seen like reports included with naloxone kits where, you know, no personal information is given at all, but if you would like to report the substance you were using, the method of use, and then the outcome, how much naloxone was required, whether or not the person survived, information like that is gathered, and then you send it back to the organization that gave you the naloxone, so that they can kind of track how much is needed, when it's needed. A lot of places do the same thing with their test kits. If you get a fentanyl test strip and you have something test positive, you do have the option to report that to the place where you got the strips. Aside from that, we depend a lot on our clients like calling and telling us or messaging us and saying like, we've had a bunch of people overdose lately. We don't know what it is, but this is the substance it's in. This is what it looks like. If it's a pressed pill that's being sold as something and it's something else, or if it's a powder substance, whatever. I mean, we don't personally deal with any testing, but that's a legality issue here. That I wish we could do something about, but baby steps, y'all. You know, we're still hoping to get syringe access programs in the state so that we can ensure people using safely. I'm not going to even try to ask Shelby or Jones or any of those fucks for fucking the right to test drugs yet. Okay. Like, no. It's a lot of word of mouth. But it's also a matter of knowing kind of the shipping channels nationally. I've got contacts all over the country. And so if there's some shit in Atlanta that's dirty, I absolutely tell people about it from Chicago to Mobile and westward, because that's going to go across the country, east-west on 40, and then down from here, you know, to Mobile, east-west on 10. It's all over the place. We're like in the intersection, so we get a lot of dirty shit pretty quickly around here.
Yeah, we do too, because I am sitting exactly 2 miles south of the I-40 bridge to get that shit to the other side of the river. So it's like, you need to stop for gas, and you know exactly what communities to go and load shit in here. Like it always seems like if something happens in Atlanta or Baltimore, it takes about 18 hours for it to happen in Memphis.
Yeah.
Spoken like true Southerners, saying like the interstate names, and like everyone's, oh yeah, I know where that is. Oh yeah,
totally.
You take
on the service road.
You take Highway 14 to get up to 7, then you go. That's how you get to Lake Martin, and it's just like
you go over by Mr. Smith's barn, and then you take a left on 18. Highway 14.
Personally, like what I've noticed here versus like up north, like especially with heroin, you don't have people stamping bags here like they would up north. So like if you get a bad batch, like no telling, like it's hard to identify like where that batch came from and all that. Like when I first heard about stamped bags, I was like, what the fuck are you talking about? Like all my shit just comes in a little baggie, and it's either black or it's either fucking tan, you know, like.
Well, that was like one of the beautiful things about like back in the 90s, because I'm an old, but it was like back in the 90s in like underground club scenes, because, you know, popular party drugs at the time were in pressed pill form. So it was really easy, and people branded their shit. And so it was really easy to know when something bad came through or where the shit step along the way was.
Girl, I remember those Mercedes rolls.
We're revealing so much about it.
See, I remember Tesla. I had a Tesla ecstasy one time that was fire.
Do you want to tell us more about that, Tyler?
Yeah, Tyler,
wait, there's a story that I want to hear.
Yeah, these are the stories. Let's go to the comedy part of the podcast and tell us some stories, Tyler.
Tyler, destigmatize drug use by.
Tell us about the PP chandelier.
Destigmatize this for us through
It might do
comedy.
the opposite, from what I understand.
All right, so friend of the show, Blankenship. It was our first week having an apartment together, and I have some friends who are in a more southern county in Alabama than we are from. They came up to Montgomery, and I was like, "This is my new apartment, so we're gonna get fucked up. We're gonna get some cocaine. We're gonna get some whiskey." I was popping Adderall and Xanax like nobody's fucking business, and we got to drinking, and I'm gonna use the guy's nickname, which everybody knows about this. His name was Pork Chop. Good Pantera listening to Southern boy. Love to drink. He got his whiskey in him, and
did y'all get Pantera wasted?
Oh, we got Dimebag Shitty. He went up to the upstairs bathroom and commenced to puking for 25 minutes, and then decided to piss and kept flushing the toilet. We're sitting downstairs listening to some death metal and shit, and I just started noticing, I'm like, yo, there's something coming from the chandelier, and it drips on my face, and, I smell it, and I'm like, that's piss, and that's definitely fucking throw up. So all the little light fixtures started filling up with that shit. It was so fucking metal. But like 7 months after this, due to my antics, I was asked to move out of this apartment by my best friend, which I was so mad at the time, but now I'm like, I completely understand. Like, I wouldn't live with me in that time. I was that same night, some dude stripped right down to his boxers and decided he was going to climb in bed and spoon Blankenship while Blankenship was asleep. That was a no-go.
That just makes it funnier because I know who he is.
Love him to death.
Blankenship just freaking the fuck out.
Yeah, that was a wild fucking night.
Oh my God.
So you got proxy pissed on by a guy named Pork Chop.
Yeah, it was great.
No, wait, time out. You were pissing and puking in the toilet, so technically you peed on yourself.
No, I didn't puke. Pork Chop puked and pissed. I was pissing outside.
I thought you puked and pissed in the. Okay, so Pork Chop peed on you.
No, see, when I do cocaine, I
Yes.
get extra paranoid, so I don't like to go up. I don't like to be in any enclosed areas, so I just go piss outside.
Like a good Southern boy. Just some good old boys. They wasn't
Gonna piss in the woods.
Them Duke boys at it again. Them Duke boys high on coke. Let's see what happens.
Let me ask you this. How many of y'all feel comfortable talking about drug use, past or present, in public?
Yeah.
I don't have a dog in this fight, so I'll let
The job that I worked with Nelson, there wasn't a day that I was not either on Xanax, Adderall, or Dilaudid. So I remember like sitting at the fryer frying chicken fingers, just nodding out, trying not to fall in the fucking grease.
Did you work at a Foosackly's?
Pretty much. Essentially, like if they were a sports bar.
It was a glorified Apple. It's a glorified Applebee's is basically what it is.
Yeah.
So be
Where we worked at.
Hey,
people
you know who would be a great person to have on this podcast for this episode, Nelson?
Who?
We're going to use code names here, but Tippy.
Tippy. I miss Tippy so much.
I ended up
Tippy?
shooting dirty heroin with him later in life.
Go
And
Tippy.
I was like, yo, this is what my life has come to. I'm in a basement with Tippy.
Oh, Tip.
Shooting dope. And he was making fun of me because I couldn't hit myself and I had to get another girl to hit me. He was like, I remember when I was so young.
Dude, Tippy told me some wild fucking stories in Chicago, but I mean, I'm not gonna tell.
See, he's the one that got me calling like good heroin. He's the one that got me calling good heroin that suck your own dick.
Oh my God, you're right.
Because you nod out and you bend forward, and I didn't understand that until I did it. And I was like, yo.
Holy shit. Dude, I miss Tippy. Do you know where he is?
Last time I heard from him, he was trying to sell me an Ibanez guitar. So I would say he's still in active addiction. God bless him.
God, he was a great server.
No, he was fun to hang around. He was not a good server.
No, you're right. Yeah, I wanted to give him some. He's not. He really wasn't. And I was like, if Tippy, that was my transition from like being a buster to being a server. I thought like I was really scared to be a server because I hated like interacting with people in that concept, and I can't count money. So I was like, all right, if Tippy can do this fucked up, I can do this. And Tippy was my motivation to conquer my fears. But I miss. I miss Tippy. We can cut that one out.
Did you just fucking
right.
dox him?
No,
We're gonna have to make a note to cut the end of the Tippy talk now.
Yeah, Tommy.
We can also make notes to cut anything that made me sound dumb, like where I say a lot.
No, the O's are gonna stay.
Damn it.
It's fine. No one really notices that kind of stuff.
Damn it.
But to answer your question, like for me, it's the answer is no. And that is entirely from a place of I just don't fucking trust people. So it's like I can control the narrative in a conversation if I want to talk about, it's like I worked in a rock club for long enough that people can make a pretty safe assumption about things I've been around and things that I have done. but it's like there's such a huge see, words are fucking hard. Difference to me in being able to like share my own story, and that I don't trust other people to not move forward and, you know, either break that moment of trust by sharing it onward themselves. And if doing so like in an accurate, so like that's why I choose not to, is because like I have, you know, deep concerns from personal experience and people coming up and telling me shit about other people that like you could tell went through a game of telephone.
Absolutely.
Yeah. So it's so like for me, like it's, you know, it's not worth the hassle of trying, you know, the first lie wins. And so it's like not worth the hassle of trying to correct any, you know, post facto exaggeration.
Our Lord and Savior Dolly Parton was on Oprah once, right? And Oprah,
I would like for you to refer to her as my mother. As a Tennessean, she is all of our mothers. So
it's true. It's true. And we love her. Okay. So your mom, Dolly Parton, was on Oprah, and there were at the time some rumors about her sexual orientation going around, right? And she's like, I will neither confirm nor deny, because if I tell you that I'm not, people are just going to say that I'm lying. And if I tell you that I am, then I'm lying. And so it really doesn't matter, right? Like, and the same thing goes for drug use. The reason I asked is I am in a kind of difficult situation where I am advocating for people who use drugs, and I am out there doing like legislation work and writing senators and going and yelling and screaming at the top of my lungs in the most sweet and polite way possible. You know, but I'm also having to kind of infiltrate groups of people that are understandably kind of paranoid about outsiders and folks they don't know, so that I can try to offer them help and ways to stay safer. Part of advocacy, though, is telling your story and humanizing the situation. And I want people so badly to feel comfortable doing that, except I totally understand. I live in the buckle on the fucking Bible Belt, and I can't talk about why this is important to me if I also want to ingratiate myself to the people who could fucking fund my program, right? So, like, talk about yourself, talk about your life, be a positive story. Like, yeah, dude, I used to use a shitload of drugs. I used to do a shitload of dumb shit. But you know what? I'm a tax-paying, upstanding, fine-ass individual now. Or not. Maybe you're not. But maybe you could be if you'd had access to something like what we're doing. You know? It's like, people got to start being able to talk about it. We've got to start being more okay with the fact that people use drugs, even when it's not comic relief, you know?
I have a question I want to ask, because it seems to be a discourse on Twitter and left book in general, but the whole debate between decriminalization and legalization. So what does decriminalization look like, and which one is, I guess, I don't want to say better, but like which one, I guess, is better overall for harm reduction?
Abolish the police.
Amen.
You do that, then you don't have to worry about either level, right? There's a perfect parallel there to what you're talking about, like decriminalization efforts versus legalization efforts are the same thing, you know, in a different direction as getting that ground level street dealer instead of getting the guy at the top of the chain. If you eliminate, you know, like that enforcement issue, who gives a fuck which level it is?
But I guess my question goes deeper into supply with decriminalization or supply. I mean, it seems like legalization would help with a better, cleaner supply that people know what they're getting, instead of decriminalization. We take the police away and we take you getting arrested for using drugs, but not necessarily it's going to help on the supply end. So Morgan, can you talk about that, or what you think?
Sure. So I think that in places like Alabama, decriminalization is a necessary stepping stone towards legalization. I think that we have to take little tiny baby steps here, because we've yeah, like that, because we've got a history of being not the brightest bunch, and we kind of have to just hold hands and walk people through shit. Stop it. That said, though, the less the government has to do with something, in my opinion, the better. And legalization still looks like the powers that be having their fingers in the pie. That's when you start looking at them taxing, that you start looking at taxation, you start looking at legislating potency, and then like how much people can be in possession of. But again, we're looking at stepping stones. I know, we're not going to just overnight go from where we are now to this perfect like drug users utopia. So I think decrim is the way to go for now. The way to get there is to make it legal to test and to have Narcan and to, teach people about it. Sex education would be a cool thing to have like fully legal too. And like, if we could discontinue this debate altogether about whether or not like dinosaurs are real or science in general, like if we could just decide that science was real, that'd be a starting point.
And on the third day, God created 30-06.
let me put this in the most Tyler way I could put it. Look, sorry, these kids' toys are going off. I don't know what the fuck's going on, but all right. So look, if you can get the legal moonshine, you can get the legal moonshine at the liquor store, but the government's got its hands in it, and it's nowhere near as good as the shit you're gonna get not from the liquor store. It's the same thing with heroin. If the government had their hands in heroin, it wouldn't be great. If they had their hands in coke, it wouldn't be what it was. It wouldn't be what people wanted. So you're always going to go to the outside source to get it because it's the stronger shit.
Well, and quite frankly, my homie that sells this amazing Applejack up around somewhere north of here, it's better and it's cheaper. And also, my name doesn't go on a list. Like, I don't have to show them my ID like I started having to do with your Sudafed and whatnot when they noticed meth finally.
So in the effort to defund police, then what would be the most productive reallocation of money to combat this effort without creating more government oversight of it?
Oh man, I wish you had just stopped with what was the best way to redo that money.
Answer both then.
I mean, what can we do with the money that we spend on cops? I mean, school, y'all, like healthcare and education, those two things, period. Because quite frankly, if we start addressing like basic needs, we could stop worrying so much about people's drug problems. Period. End of sentence.
Fuck yeah.
Education, healthcare, housing is healthcare.
Fuck yeah.
Sex work too. Decriminalize sex work, legalize sex work, whatever. I guess it's not a problem if we've defunded the police or abolished them altogether. But, education, healthcare, housing.
The trifecta.
My opinion, I think they teach sex ed in school, or in some schools they do. I think harm reduction should be also something taught in school because, like, that's the best time to get those kids.
So that's on the list of many, many things that I'd like to advocate for in the future. But again, like, we have to get our name not to just put a stinky taste in people's mouths in the government to begin with. I would love to have included with like sex ed and drug education that's in our common curriculums. What do you do if you see someone you think might be overdosing? How do you recognize an overdose? Because quite frankly, like our mental picture of like the junkie, the terrible demonized junkie is inaccurate. Also, it's Meemaw, y'all. Meemaw is high, and Meemaw is confused, and she might fuck up and like gork out one day, and your kid finds her. Do you want to still have Meemaw for Thanksgiving or what? Because like
This
that's
whole
a real
time I thought you were talking
possibility.
about Ivy.
What?
Dude, you know Governor Meemaw. Governor Meemaw loves her. skin, man.
Look, I'm not talking about Kay Ivy. I totally forgot. We call her Governor Meemaw because I
Governor Meemaw.
forgot about her in general. Because where the fuck is she? Where is she?
We know where
Has
she is.
done anything?
Nodded out in the government mansion.
We know where Governor.
that legal
No,
note.
she's not in the governor's mansion.
She's
She's at
face
someone's
down on
house.
Governor on Richard Shelman's dick right now. Is what she is.
No. We all know where Governor. We had that controversy with Patricia Todd. We all know where Governor Ivy is. But that's look up Patricia and Governor Ivy and that whole controversy. But
No.
Oh, Governor Meemaw.
I just don't like that kind of gay porn.
Yeah. You've answered all the questions that I've had. Tyler, Kate, do you have anything else?
Yeah, you said you need money. Where can people send you money? We have the kindest listeners in the world. We'd love to help.
Oh my goodness.
Where can we send you our Patreon surplus?
Honestly, right now, Black Lives Matter.
Dig it.
Straight up, Black Lives Matter. That's where. Please.
I'm gonna go ahead and say this. I don't need Nelson's clearance, but if you can prove that you donated to Black Lives Matter, I'll send you a free cookbook.
But oh shit. I keep losing the there I am. I keep losing the screen. Yeah, that's totally cool.
I'll add a bonus to it. You also get 3 cocktail recipes from me.
Ooh. I might be persuaded into sending you a really cool bumper sticker.
I'll do Dixieland the Proletariat ASMR with my new microphone.
If you are interested in Goodworks merch, which is pretty cool looking stuff,
Yes.
You can go to radhealthresources.org. We've got a couple of shirt designs up there, including one that says, please test your Coke in the bathroom, in a really
I love that. I'm going to cross stitch that now. Everyone always asks for the please don't do Coke in the bathroom. And I fucking hate it because it's like, so one, it's super cliche and I hate stitching things that I think are like fucking dumb Etsy trash. But that is like really useful and I love it. And I'm going to stitch it because like.
The other one is a black background with a red plague doctor mask that happened before COVID did. I'm so fucking sorry that COVID happened and now it just looks basic. But anyway, it says do no harm, take no shit in Latin around the outside of the design. It says Goodworks, North Alabama. Anyway, that comes on t-shirts and hoodies and crop tops, maybe, perhaps. But please, for real, Black Lives Matter first. Do that first. Fuck my merch. Go pay for Black people to be treated like people. That'd be great for me and you and everyone. Thanks.
Tyler, do you even know the story?
No, I've got a question. I've
You
heard
keep
from
going.
people, and I've noticed that like overdoses have been going up a lot from what I've seen personally. Like this is anecdotal or whatever the fuck you say it, since COVID started happening. Have you noticed anything of that, Morgan?
Absolutely. I just erased the numbers off my whiteboard like today, stupidly. But the Jefferson County, I believe, or no, I'm sorry, Morgan County, Alabama saw 30% of their annual overdose average in 30 days. So we're ahead. Madison County has an all-time record for number of hospitalized overdose patients in the last 30 days. And Jefferson County has, I think, tripled their numbers this month.
Is
Oh, yeah.
Is that due to, increased isolation? Is that due to depression? Is that due to all of the above? Is that due to, changing economics?
Depression, isolation. Please don't use alone. That's actually something I did want to drop really quick. I cannot, cannot stress this enough, right? Don't use alone. And COVID has made that more and more difficult. We now have really cool stuff like the internet and the telephone. There is an organization called Never Use Alone that has an 800 number that you can call so that somebody can essentially sit there and trip sit. They don't care who you are. They've got to get your information just in case you become unresponsive. But this is a group of people who have volunteered to do this regardless of they're not going to call the police, right? This is not about like taking your information. We don't share that shit. I am the lead for the Alabama line, full disclosure, but you know, come on, y'all. I'm the lead for the Alabama line. Like, anyway, their number is 1-800-484-3731. If you have to use a substance and you have to do so alone, someone will be there to answer the phone. They'll ask you for your name and your address and the substance that you're using. If you stop talking for too long, we will call 911 so that you don't die. That is it. That's the only reason for that phone line. Please use it.
Do I got time to tell my bath salt story?
Yes.
All right, real quick. So I was using with a really good friend, and I was on heroin at the time. She was on meth, and she'd got this sketchy meth, and I was kind of, you know, heroin makes you very like, whatever, you know, I'll do whatever. So she's like, hey, try this. Make sure this is what it is, because it doesn't feel like what it is. Well, I got hit with this, and I started feeling good off of it. I was like, yeah, this is some all right meth. So I just started sniffing out of her bag for like the next hour. I was high for the entire fucking week, and I was with the same person about 4 days later on my way home from work on 65. I stopped in the middle of the road in my car for a minute and a half to let a purple centipede cross the road. It was, don't do bath salts at all. It's fucking terrible.
Do whatever you're going to do, but just like stay indoors, maybe. Yeah, you know, you've gone too far when the shadow people have fucked off. When they're like sick of your shit and they leave, that's when you know it's time to take a nap.
Also, if you're going
Definitely.
to be sharing with people, please be honest about what it is that you are using and that you are giving to them for a multitude of fairly obvious reasons.
Nobody
Yeah,
likes surprise drugs. Surprise pizza.
Another quick story. Like, if use around people that you trust, because one time I nodded out, woke up without an Xbox in a car. So like that shit can happen.
Honestly.
Not the Xbox.
All this can be avoided if you just test your drugs before you do them.
Yes, I back that 100%.
They stole your Xbox? That fucking sucks.
And then kind of wove it in like a couple months later to them. It was them making an amends to the person for them stealing their Xbox. So it was like in some kind of weird Xbox theft triangle.
What the fuck?
Yeah. Shit was wild.
Morgan, you look like Clint Eastwood right there with that cigarette in your mouth. You're like, yeah. It was ready for you to like drop some really serious, like, yeah, they could fuck right off. All right, Charles, anyone have any closing remarks before I end it?
Defund the police.
What? They should totally test drugs and, you know, legalize the doing of that, or just fuck the police anyway. And, you know, fuck Black Lives Matter. That's my answer.
Hell yeah.
Yeah, stop killing black folks, please.
And you know, fuck prison also. Prison.
Yeah. Yeah. Incarcerating drug dealers is just slave labor. So that's my opinion on that.
Down with 13th Amendment slavery.
Dig it. All right, Kate, anything else?
No, man, I'm good. I think it's pretty well covered.
Hell yeah.
So I'm kind of like real in my feelings right now.
I'm about to get
the most,
I'm about to get
the
real
most
in my
chatty.
feelings right here in a second.
So I've like, yeah, you know,
Why are
like,
you in your feelings, Kate? Do we need to start a whole other talk show?
oh no, it's just, you know, I mean, like there's a lot of subjects that we discussed this night that, you know, like hit really close to home, you know, and I think that's true for a lot of people. And I'm going to digest that. And my best friend's sitting outside, so I'm going to smoke some cigarettes and cry at him for
Oh, Lord.
It's what I do every Monday. Like, it's fine.
I mean, every day. Yeah, me too.
Yeah.
Thanks, drugs.
Hell yeah. All right, y'all. I'm going to do this real quick. At Dixieland, the proletariat, we believe the South will rise again, but this time for the right reasons, those being worker-owned means of production, decolonization, and self-determination for all oppressed peoples. We are coming to you from the heart of Dixie, Montgomery, Alabama. We'd also like to recognize we're recording on occupied land. The rightful belongs to the Muskogee and the Chickasaw and their people. And I think that this person I'm about to talk about would have really enjoyed this episode. Sunday, we lost a really powerful member in the socialist movement. A dear friend of mine, a dear friend to a lot of people, Mimi. Mimi was the former chair of SPUSA, and he also was the 2016 presidential candidate for Socialist Party USA. He lost his battle with liver cancer, unfortunately, and it has just been a rough 2 days rough day. Yeah, it's just been rough because I never realized how many friends that I had on Facebook because of Mimi, and just seeing like the outpour of love and respect that we had for this person and how he helped a lot of people. He always gave an ear to anyone who needed someone to listen to them. And I was lucky to meet him twice, and we had a lot of cool inside jokes and a lot of great stories. And he was just overall a really fantastic human being. And I found this quote of his that really goes into what he believed in what the socialist movement is all about, especially coming up with a presidential election. Mimi once said, "We don't look to a presidential campaign to provide the solutions. We look to the people. The people are going to lead us." And I just want to say rest in power, comrade. And until we meet again, I miss you, buddy. And we all miss you, and we love you. Yeah. All right, y'all.
Thank you for having me.
Thanks, Morgan.
Thanks for being here. It's nice to meet you.
All right. Well, we'll see y'all next time. Good Lord willing, and the creek don't rise.
Hell yeah.
Joining me now, Mimi Solsitic, who was a 2016 presidential candidate for the Socialist Party USA. All right, Mimi, I just want to go slowly here because socialism confuses me a little bit. Has socialism worked anywhere it's been tried?
I think what we're working toward is something that we've yet to see. Socialism at its core
did they try
means
socialism?
Worker ownership and control over production.
All right.
So I think it's important that you understand what it means and that your viewers understand what it means.
Okay.
So we're capable of progress.
Okay.
You know?
So did they try socialism in Venezuela?
You know, it's funny that I expected you to bring up Venezuela. It's such a weak talking point. You're talking to somebody who lives in a city that's got over 50,000 homeless people. So this diversion over to Venezuela.
Oh, no, I'm just asking where has socialism worked? Has it worked in Cuba?
Okay.
Has it worked in the
let's look at Cuba's
Union?
literacy rate. Sure, let me respond. Let's look at Cuba's literacy rate. Let's look at their health care. You know, let's look at countries that have universal health care and how they rank against the United States health care system. They far outrank in terms of quality of care.
Socialist healthcare in Canada, and a lot of the rich Canadians come to America to get their surgery. But let's just move on.
The last time the world.
Let's just move on. I don't want to
move on because you're wrong.
Okay, that's your opinion.
And you don't even care that you're wrong, which is bizarre.
No, I don't believe I'm wrong, but that's fine. We can move on. I just don't want to get bogged down on other countries. Let's focus on America here. You want socialism to replace capitalism here in America?
Of course I do. I mean, To say that I'm a socialist, that I don't want to see an end to oppression and exploitation, of course I want to see socialism replace capitalism.
I pay about 50% in taxes to the government. How high would you like to see my taxes raised to?
We would support a steeply graduated progressive income tax.
How
As it
much?
stands right now, the U.S. has...
I mean, let's just take me for an example.
Can you stop interrupting me for a second?
No, I'm trying to move the conversation forward. I want to get specific on your policy.
Sure.
What would you like to see me pay in taxes?
Okay, let's say this. I don't know how much you earn, but let's just say hypothetically it's $1 million, right? Let's say you were taxed at 70%. If you can't get by on $300,000 in a country where so many are struggling, just let me finish. This is why you're having a problem right now. This smug smarminess in the face of suffering, it's not resonating with folks. Your days are over.
Well, listen, I would say this. I would say in the countries that have socialist policies, there's more suffering. In China, in Cuba, in Venezuela, and the Soviet Union, that system didn't work. And it wasn't those countries, and it's not those countries that feed the world and protect the world. It's the United States of America. And we have capitalism
the United
at
States
its foundation.
Destroys the world. The United States
the world?
feeds and protects the world? You got to be kidding me. Conservative estimates since World War II show that the U.S. has killed at least 20 million people since World War II. The United States is an imperialist country. Its riches are built on the backs
I don't know what you would have done with Nazi Germany.
The developing world.
I don't know what you would have done with Nazi Germany, but I think America made the right decision there.
Are so weak.
Mimi, I will have you back on, and we'll give you more time, and we can discuss things in more specific. But you know what? We got to pay the bills because we got to sell advertising. We got to have a commercial break.
I know you do.
Thank you very much.